I talk about what it felt like in the early days where I would share that I was living with HIV and people were shocked. The exclusion, the isolation impacted women so much more. And the social isolation is something that continues now because so many women are afraid of the impact it'll have on their family. They will be shunned at church, or that their child would be judged at school, or that they'll lose their apartment that's the roof over their head. So much of that still continues today. Women live at the intersectionality of life. Women are the keystones to communities, and a lot of times women want to be strong and don't actually identify those intersectionalities. They talk about poverty, we talk about racism, we talk about sexism, and I think we also need to talk about mental health, about substance use, about intimate partner violence. Intimate partner violence and trauma led me to being exposed to HIV. Growing up, I had been assaulted and didn't actually even share with my family about it. So I didn't have a chance to heal or to learn healthy boundaries and values. When I grew up and I started dating and I went out into the world, I chose really unpleasant men for, the dangerous boys, for lack of a better term. Turns out bad boys are liars and are drug users. And in my case, my bad boy actually transmitted HIV to me. I was not at all thinking that I was somebody who needed to worry about HIV. I did all the surveys in the newspaper, like, are you at risk if you've had more than 4 partners? And I'm like, oh, that's not me. But I had some friends. I had some gay men friends who had been really popular, but I was worried about them because they were really good friends of mine and I wanted them to know their HIV status. Kind of, I actually tricked them a little bit by saying, hey, we're gonna go out and have drinks, it'll be lovely, and I'll be the designated driver, and they should have been so suspicious. So we all loaded into the car and pulled up at the testing center, and I wasn't planning on getting tested because, again, I was so low risk that women like me, people like me, women, didn't need to worry about HIV. And the testing counselor asked me if I would go first and if I would sort of volunteer to lead my friends. And I was like, yes, I can do that. And so I got tested, not even planning on it. And ironically enough, none of them were HIV positive, and I was. And it was a shock because we had planned how we were going to support one of them, and instead it was me. My husband and I were newly married. I actually expected that we would get divorced because in my mind, like when tough times come, relationships end. I was in Madison and he was in Chicago. And so I call him up and I'm like, hey, okay, so I got my HIV test results back and I'm living with HIV and we should get divorced and we'll talk about it this weekend. And, fortunately he realized that was shock and that was not me really processing or talking. And so he hopped in the car and we sat and we laughed and we cried and we just talked about what we were going to do. My husband got tested. He's HIV negative, and he said that he wanted to help support me as best he could, and that I had to promise I'd be healthy for 10 years. I crossed my fingers in case I was a liar and said, okay, I'll be healthy for 10 years. And here I am, and we've been married for 24. And the biggest reason why I'm here, why I'm able to be an activist, why I'm empowered and can tell my story, not just my story, but women's stories, is because my husband has been there every step of the way. I feel incredibly blessed that I had such a positive reaction. I wasn't expecting violence, but I have had violence in my life, and so I know that sometimes when men get angry, things can be violent. And we now know, even in today's times, that women are disclosing their status, or their status is found out and they're being killed by their partners. And what's even worse is that the media and society seems to think that that's justified. So I know many women who don't disclose, don't date so that they don't have to disclose, don't talk about living with HIV, or just entirely disconnect any part of their life that needs intimacy or craves partnership. And I think that that's really sad, and it goes back to the stigma and the discrimination that we talked about. It was challenging because I talked to the priest at my church and he told me I was a sinner and was damned. Ouch. Thank you, Catholic Church. I told the people at work and I was fired because I was an executive chef, and they don't like to have people who are living with HIV in kitchens because the public is so fearful of that they might get HIV, like it's cooties or something like that. My family and I are very, very close, and I went 6 months without telling them. And it was the longest 6 months of my life because I couldn't share sort of the challenges and the ups and the downs. When I told my family, I was like, okay, that's it, I'm not going to tell anybody else. And I lived that reality for about 9 months until a high school age friend of mine, so it's a daughter of a high school friend of mine, and she came over and she's like, well, I'm thinking about having sex with my boyfriend, and he says he's a virgin and I'm a virgin, so we don't need to worry about it. And I'm like, oh my God. And so I kind of instantly got catapulted into advocacy by being worried about somebody else. You know, we talked about condoms, we talked about getting tested, we talked about, this sounds really harsh, but people, when sex is in the room, lie. And so she started bringing her friends to me, and I started talking to her friends. And then one of the teachers at school found out and asked me to come in and talk to a women's group at the high school. And then I started telling my story for our local AIDS service organization. And so that's how it was, just really literally was that automatic, like, wait, oh my God, no, you know, kind of perhaps maternal, protective kind of way. And then I got involved in like advocacy on a federal level and a national level through the US Positive Women's Network, lending my voice for those women who couldn't be open about their status because they were afraid that they were going to lose their children in a custody battle, which happens. Or they were afraid they were going to lose their apartment, which happens, that they were going to lose their job, which happens. So I was kind of the touchstone for so many women. They would share their stories and then I would amplify it. And that is where I got my real passion from, because, you know, not one more. We don't want one more woman to acquire HIV. It should be done. It should be over. We have the science, we have the understanding, and so that's what I work on now, and that just gives me such passion. I think that the needs of women are very different from the needs of men, and so by definition I have to also agree that the needs of African American women and Latinx women and trans women are very different from the needs of white cis women. I think that we need to come together as a community of women and address those needs, and then I think that we need to recognize that our sisters of color, our sisters of trans experience need to be centered in the response that addresses their needs. So what I choose to do is to stand behind them and to say, what can I do to support you? Can I break down the door to get you into the room? You know, can I lift you up so we can climb in the window? What do we need to do to get you there so that you can talk about what your needs are? But what we really want is to have the right people, the right women in the room, centering those conversations about what their communities need in a way that only they can understand. But we also need to acknowledge that as white women, we have a responsibility to talk to other white women living with HIV or not living with HIV about what this current system does to people of color and to women of color and to women of color living with HIV, because they really, really are fighting a tough battle, and we don't want to be contributing to that problem. So there's not enough women in leadership positions. I'm just going to say that for starters. You know, I would say HIV-specific advocacy groups don't have women leaders, and that to me is really problematic. And so I think that leadership positions are powerful. I think that employment is also really powerful. I'm just going to segue that in. You didn't ask about it, but I'm going to segue it in, because a lot of times I talk to women who are newly diagnosed or who are just starting their advocacy journey, and they are offered peer advocate positions that are either unpaid or are siloed so that they're not part of this leadership team. I think that we need to ensure that leadership, being staff, being board, being executive team, whatever, in every organization needs to have women living with HIV as part of it, because we know the unique needs of what our group is demanding. And I think that women oftentimes believe that they're not leadership quality. And so that's part of the reason why at PWN we're really working to develop a policy fellowship team so that women know that not only should they be part of leadership, but they're qualified to be part of leadership and that they damn well deserve to be there.